Have you experienced or witnessed a traumatic event? Then you may experience symptoms such as fear, anxiety, sleeplessness, restlessness, or flashbacks.
Oh my God, Tim, are you okay?
Oh my God, what was that?
I'm not sure. I thought they were popping stuff.
These symptoms are normal, but if they last for more than 3 months, you could be suffering from post-traumatic stress disorder.
How long has it been since you got back from war?
I've only been back 7 months. I served 4 years at Iraq.
And you're still having flashbacks?
It's pretty scary. They get intense.
Well, maybe you should see a doctor about this.
Maybe you're right.
Yeah.
Post-traumatic stress disorder can occur after losing a loved one unexpectedly in a traumatic event, physical and sexual abuse, natural disasters, and more frequently in combat. These are the faces of PTSD.
Pharmacological treatment is one of the approaches used to treat post-traumatic stress syndrome. The type of pharmacotherapies available include SSRIs, tricyclic antidepressants, other second-generation antidepressants, norepinephrine reuptake inhibitors, atypical antipsychotics, anticonvulsants, mood stabilizers, MAOIs, adrenergic agents, and benzodiazepines. As of 2019, only paroxetine and sertraline are approved by the U.S. Food and Drug Administration for treatment of post-traumatic stress syndrome. The potential goal with the administration of these drugs includes modulation of stress effects on memory consolidation after trauma and punitive cognitive enhancers that target mechanisms of conditioned fear reconsolidation. Generally, medication for PTSD is used in conjunction with psychotherapy treatment. The medication itself can aid in relief of the symptoms. However, it may not ease an individual of a flashback and feelings that are related to the flashback. A relapse of post-traumatic stress disorder will be less likely if the medication is prescribed more than a year. This is seen with antidepressants such as SSRI antidepressants, fluoxetine, sertraline, and paroxetine. Outpatient therapy is the indicated treatment for post-traumatic stress disorder. Cognitive behavior therapy, both individual and group therapy settings, may prevent acute stress disorder from progressing to PTSD. Cognitive behavior therapy and therapy programs that incorporate cognitive behavior therapy are also the most common and effective types of formal treatment for PTSD. Clients can choose individual counseling therapy or group counseling therapy. 3 types of non-pharmacological treatments for PTSD include exposure therapy, adaptive disclosure, and cognitive processing therapy. Exposure therapy is designed to help the client work through their thoughts and feelings rather than avoid them. It also helps the client gain control of and regulate those feelings by confronting the feared emotions and situations they are experiencing as a result of their trauma. To help the client accept and cope with their anxiety, relaxation techniques are used. Exposure therapy may incorporate imagined confrontation or reality confrontation. Veterans and active military personnel partaking in prolonged exposure therapy have shown the treatment to be beneficial and effective. Adaptive disclosure therapy, developed by the military, is a specialized cognitive behavior therapy approach that helps with PTSD. This method combines exposure therapy and the empty chair technique, in which the clients verbalize what they would like to say to someone, whether alive or deceased.
Okay, Shannon, I'm going to get you to talk to your other significant other and tell him what you would like to say.
Actually, it's okay. I'm going to speak to his commander. Because you sent my husband away. You sent him into that field with those bombs. You took him from me. You left me with our kids.
Another example of trauma-focused therapy is prolonged exposure, or PE. This technique teaches you how to gain control by facing your negative feelings. The client confronts the feared emotions or situations and thoughts associated with the trauma instead of avoiding them. It may include returning to the place where one was assaulted, or even driving again after a traumatic motor vehicle accident.
Oh no, doctor. After my accident, I am so afraid to drive. Like, I Someone's gonna, what if I kill someone again?
Well, I'll be right here with you, so I promise it'll
That
be
person
okay.
died because of me. I can't get behind the wheel.
We're gonna get through this, because I promise I'll be right there with you.
I'll
And
try.
we're just gonna go right around here.
I don't know.
It'll be quick and fast, but we're gonna get through it together.
I can't promise anything. Okay, I'm
We'll
gonna
just
try.
We'll try.
Okay.
I don't know. Okay. Oh, come on, Shan, you got this. You can do it. I don't know.
Oh gosh.
I don't know. I just don't know. We got this, Shannon. Okay. I'll try. I don't know. Oh, I'm right here. I gotta do it. You got this. I just did. You got this.
I did it! Oh my god! Yay! Thank you so much, Dr. Liz. I finally drove a car again.
Therapy on an outpatient basis is the indicated treatment for PTSD. However, in times of severe crisis, short inpatient stays may be necessary. There are several types of therapy recommended to treat PTSD. Cognitive behavior therapy, CBT, and specialized therapy programs using elements of CBT are the most common and successful types of formal treatment. The choice of therapy depends on the type of trauma, as well as the choice of formal or individual counseling. Trauma-focused psychotherapies, or exposure therapy as it is referred to, are the most highly recommended therapies for PTSD according to the U.S. Department of Veterans Affairs. In this type of therapy, the treatment focuses on the traumatic event or its meaning. Some involve visualizing, talking, or thinking about the traumatic memory, while others focus on changing negative beliefs about the trauma. Examples of trauma-focused therapies are eye movement desensitization and reprocessing, or EMDR. This technique helps you to process and make sense of your trauma. It involves calling the trauma to mind while paying attention to a back and forth movement or sound, like a finger waving side to side, a light, or a tone. There are other types of trauma-focused psychotherapy that are also recommended for people with PTSD. These include brief eclectic psychotherapy, narrative exposure therapy, and written narrative exposure. These types of therapy include relaxation skills, recalling the event and putting it into a story, writing a letter, and then at the end of the session, briefly discussing thoughts and feelings. Therapies that are not trauma-focused include stress inoculation training, which is a cognitive behavioral therapy that teaches skills and techniques to manage stress and reduce anxiety. Present-centered therapy focuses on current life problems that are related to PTSD. And interpersonal psychotherapy, which focuses on the impact of trauma on interpersonal relationships.
Hey Kim, how are you?
I'm good. How are you?
Good. Did you ever go see the doctor about that episode you had?
I did. I've been seeing a therapist now for about 3 months. My triggers have decreased. I got some medication to kind of manage my symptoms. So everything's been going good, and I thank you for, telling me to go see them.
All right, well, I'm glad you had some help, girl.
Thank you.
No problem.
Participating in a cognitive processing therapy course can help the client deal with erroneous feelings, recognize their thinking, regain balance of thinking, and achieve realistic ways to view themselves and the world to help them move forward through PTSD. Both individual and group cognitive behavior therapy sessions are effective, non-pharmacological treatments that are beneficial outpatient options in dealing with PTSD symptoms, such as insomnia and anxiety. When counseling alone is not successful, a combination of medications and cognitive behavior therapies can be used to enhance the client's progression working through PTSD.